COVID-19 is the disease of our time, and we are all doing whatever we are today in a different way because of this disease. The effect of this disease on our lives right now and for the foreseeable future it has had a great impact, and it will continue to have one. So in this class today, I am going to talk about COVID-19, the disease, and talk about how it intersects with public health. This is a public health failure, which is where we have this disease, where it is now. What is COVID-19, the disease? It's caused by coronavirus. That was the first name we heard when it started in February. Or at least that was when most of us heard of it. It is a coronavirus, and a coronavirus is an RNA virus. What are RNA viruses? Most of you know of DNA. That is what we humans have. An RNA is like a DNA, but a single strand. The D in DNA stands for double. So we have a double helix DNA, where the RNA is a single strand, just like our own DNA, but so it's a simpler organism. That's what they're viruses with DNAs. What are the other diseases that are caused by coronavirus? There's the common cold. There are actually two coronaviruses that cause various common cold symptoms. The common cold is very mild. It has been with us. We feel that the coronaviruses that cause the common cold started infecting humans probably thousands of years ago. Our body is used to them. They do not cause severe disease and barely even cause even fever for the most part. The other two are a little bit more serious. The first one, SARS, is the serious acute respiratory syndrome. And this is an important one because the coronavirus that is causing COVID-19 is most similar to is this virus that causes SARS. The virus for SARS is actually called SARS coronavirus 1 now, and the one causing COVID-19 is called SARS coronavirus 2. Just to see how similar they are, called the same name. This MERS is Middle Eastern Respiratory Syndrome. All two, and including COVID-19, are recent human diseases. SARS is most similar coronavirus to COVID-19. I want to talk about these three some more. China is the source of both SARS and COVID-19. Both diseases started in eastern China, but in two different regions of China. SARS started in November of 2002 and, in quotes, disappeared around February 2004. Each person infected around 2 to 4 people, and overall, the total infections recorded was about 8,000, and about 800 people died. The eastern China zone that it was started from was called Guangzhou, which is an industrial area of China. A lot of factories, especially small and medium factories, are around there. Middle Eastern respiratory disease started in 2012. The first case was identified in 2012 in Saudi Arabia. The species that the virus infects naturally are camels, and it infects less than one person infects less than one person, which is what the arrow stands for. Saudi Arabia was when the first cases started, and it started in camel handlers. Camel handlers were getting infected, and some of them were transmitting the disease. It's not a disease that is highly infectious. Over time, up to around the present, there have been about 2,500 cases, mostly in the Middle Eastern areas of the world where they breed camels for fun or entertainment. The biggest outbreak of MERS occurred in Korea, South Korea specifically, of a businessman that went to Saudi Arabia, and as happens in most Arabian countries, when you go as a tourist or as a businessman, you are taken to ride camels, and it's part of the tourism experience. He did that, and then he got back to Korea, and he was sick, and he wasn't diagnosed with, of course, it's a rare disease, nobody expected it, and he shopped around because he wasn't getting better. And the waiting rooms he went to, people in the waiting rooms with him got infected. In total, he ended up infecting about 500 people. That's the biggest outbreak ever. How has MERS been controlled? MERS has been controlled by testing camels and killing the camels. We call it calling the camels that are infected so that they do not infect humans. The last outbreak occurred in Sudan, which was not doing testing. And it's only been in countries that have camels unless somebody flies out. Very rare disease, not very common. SARS disappeared, I mentioned. How did SARS disappear? It got to 30 countries, excluding the US. There were no diagnosed case in the US. The last case was actually in Canada, and that case was diagnosed, treated, and the person got better. And that was the last case known. Why did it disappear? It disappeared because all the country it got to did simple public health things. Testing, when you are quarantined, everybody at the airport was questioned that came in was questioned where they had been. They were tested, they were isolated if they were positive, they were quarantined if they were suspected. Just the simple things in terms of public health tools that humanity has used for thousands of years. Even when our ancestors knew nothing about the bacterial or viral cause of diseases, they stopped disease. They didn't even have testing. But if you were sick, they made sure that you were not moving around in society and infecting people. These tools are still available with us, and we're more sophisticated. No disease should be rampaging us as it is now. COVID-19, again, started in November of 2019. Each person infects 2 to 2.5 people. This slide I've had since about April. That is still true. The second part of it is no longer true, in that, yes, it's from China. It started in another province, not Guangzhou, but Wuhan. And right in April, it was 1.45. As of this morning, it's about 29 million infections worldwide and about 1 million deaths worldwide. So Wuhan also is a region of China, or the city of Wuhan itself was turned by the Chinese government into like a transportation hub. So it has a huge airport, and it has a huge train station that leads to other parts of China. So basically, a disease starting there will move around the world pretty quickly. What is the disease, COVID-19? It enters the body through the mucosa of the nose or the mouth, and also the eyes. That has been found. But because the mucosa is not our skin, it's all the other membrane that are in our nose and in our mouth. The membrane that is a mucosa in our eyes is pretty limited, but there's been documentation it can enter through that too. Intact skin will not get infected. If somebody sneezes on your skin and has COVID, you will not get infected unless part of it gets through your mouth or your nose. Replicates there, where it gets to, it starts infecting cells and kind of, with each cell, as it kills the cell then bursts open, the virus moves to the next cell. That's what this replication is. And it slowly moves down the respiratory system. The initial symptoms are loss of smell, cough, and fever. And of course, we know some people have such mild symptoms, it's not even detected. If you sneeze a couple of times a day, you're not going to think you have COVID. And so some people have actually very severe, this disease starts in severity, and some people don't even notice anything different in their lives. And then it progresses down the respiratory system to the lungs. When it gets to the lungs, if it leads to pneumonia, that is when people are then get on the ventilator, and things can go downhill from there. So this slide just shows those initial symptoms, the first symptoms that occur before it gets to the lung, and then you start to have lung symptoms. Most people with all this symptoms will not end up in the emergency room. Most people will not even go to the hospital for this until it gets much more serious. So in the lungs, what happens in the lungs? In the lungs, the organism starts to destroy the lung cells. That is actually its main destination. The mucosa is just for it to get down. So when it gets to the lungs, it infects lung cells, and as those lung cells die, there is an immune reaction in the body. And I'll talk a little bit more about immune reaction. The immune reaction sends what are called cytokines. Our immune cells send this to just tell the body that something bad is happening in the lung. Go and destroy this foreign object that is there. And in doing so, because the virus is in the lung cell, it also kills, this messenger also kills the lung cells itself. So the body wages this severe reaction, so it becomes a very severe pneumonia. And this is what actually we'll find that is different in people. Some people, it will get to the lungs, and there's the immune reaction is so mild that over time, the virus, the cytokines kill off the virus without destroying a lot of the lung cells. So the worse your immune reaction is, the worse the disease actually in the lungs for you. So the pneumonia continues from the virus itself, and then from the cytokines there to help you live, your immune system, so that eventually there's so much lung tissue destroyed that you cannot breathe. You then need to be on a ventilator. If you still cannot get enough oxygen through your lungs, your tissues start to die, because we need oxygen every minute of our existence. Once your organs start to die, you have multiple organ failure and death. Women mount less of an immune reaction to the virus, which is one of the things we found is that, and the reason for this is a little bit interesting if you are interested in immunity. Women's immune system is created in a way that allows you to keep a DNA, a foreign object in your body for 9 months. The male immune system does not need that efficiency. So anything it sees as the other, it attacks. The female immune system has to prepare that it's possible for the female body to have a foreign object for 9 months and keep it safe and deliver it and actually see it as itself. Once that baby is out, it's a foreign DNA. If you try to put that baby out, you cause an immune reaction in that woman. If you take the blood from the baby and put it in the mother, it's a foreign object. So that has made the female immune system adapt in a way that it doesn't treat foreign objects as severely, and that is why you find that mortality is higher in men than in women with COVID-19, or at least the lung effect. Children also respond to COVID-19 in a muted way. The immune response is muted. But this is an interesting thing. We'll come back to it again in children, because children then have a long-term effect that the short-term immune reaction in the lungs, they don't seem to get. So what are this immunity that I've been talking about? There are two kinds of immunity, adaptive and innate. The innate one is really easy to understand. Anything foreign to you, your body sends all these cells to fight it out. You get a pin prick or a little twig enters your finger, all these cells will be there, and that is where you see connective tissue, they bleed, they're trying to say this thing that entered is not you. And they try, and then they're trying to kill it. If they can't kill it, they'll form connective tissue around it to keep it outside your body. That everybody has, and everybody has that reaction. The adaptive immunity is different. There are two types of adaptive immunity, B cell and T cell. The B cell is what gives us antibodies, and this is why vaccination is important. We get antibodies when we're vaccinated. The T cell are cells, and these cells, I'm not going to name them because the two main ones are the CD4, CD8 T cells. And what has been found is that the T cell immunity is a very big part of COVID-19 disease. These are the cells that go into the lungs and start to produce cytokines to kill the virus and the lung cells that are infected with the virus. If a disease does not mount a lot of antibody reaction, it is very bad for vaccination. And this is why it might be complicated. We might get there, but it might be complicated to get a vaccine against COVID-19. So the B-cell immunity is the humoral immunity. It creates antibodies. And this, the T-cell immunity, is cells that react. Both of these are called adaptive because your body reacts because it has seen it before. So the first time your body sees a virus, for example, it fights it. But if it sees that virus again, it will now be more efficient in dealing with it, which is why vaccination works, right? So basically, these two systems is different in everybody. It's based on what your body has seen before. If you've not been vaccinated and you've not been exposed to a disease, you will not have the antibodies against it, and your T cells will not recognize it. You will not have specific T cells against that virus or bacteria or whatever organism it is. So these are adaptive. Your body adapts based on what it's exposed to. And this is what we try to improve when we vaccinate or do anything to improve. This is a general thing that the body does. So, what are the phases? I've kind of alluded to this. We think there's an initial phase in COVID-19 when we can't detect the virus. We're not sure if there's a time when we can't detect the virus. But we know that by the time we are able to detect the virus, in some people, it goes down very quickly. That is the short line. And then they're better. There's a viral phase, you can detect the virus, they really don't show any symptoms. If it gets to the cytokine phase, that is the side where you have the lung effect. People in the cytokine phase are the ones going to have pneumonia and a lot of lung effects and lung disease issues. If people survive that, and some people actually do not show the cytokine, they will just go to the coagulation stage. And each stage, usually the virus load goes down, which is the line. The coagulation stage is when people start to have strokes. And this has been documented, in which the blood is clotting within the cells in an abnormal way. And that has been recognized too. Then the late hyperinflammatory stage. This is the stage that occurs in children a lot, and a lot of women too. And this is when you have people that have reddish things on their face. Their faces are reddish. They have all kinds of bumps, and most of it is cutaneous. It's things on the skin in which there's just an inflammation on the feet, reddened chest, and this stage usually is uncomfortable, but is not deadly. And that phase is what you find a lot in children, and many children don't even show the earlier phase. You will be able to detect the virus, but it's not as much. And so by the time you notice they have the disease, they just have this reaction that usually is what makes them end up in hospital, and they're not feeling uncomfortable and in pain because they have this inflammation on their skin that looks red and is uncomfortable. And women too tend to get into that coagulation phase and sometimes the hyperinflammatory phase later on in the disease. Comorbidities, we've heard a lot about this too. This is important. A paper just came out and just said that for children that die from COVID-19, for example, almost all of them were obese or had asthma. So comorbidities influence how you react, apart from your immune system. Usually, the reason is that most of these diseases, all of them are chronic diseases that people, are common in society, is that your immune system is already under stress. So basically, when you have COVID-19, then the body, the reaction in the body is so much more severe, and the body cannot take, and so you have severe disease. Obesity, asthma, hypertension, smoking, and diabetes. The smoking one, of course, is obvious because it's the lung. The diabetes, hypertension, chronic diseases that also have a long-term effect on making your immune system not function correctly. Herd immunity. I'm going to talk about herd immunity because it's in the news a lot. What is herd immunity? Herd immunity is a word that came from actually farm animals and veterinarians. That's why it's called herd. Cow herds, specifically. It came from cow herds because what was found was that farmers wanted to save money. And sometimes when veterinarians went to farms to vaccinate cows against diseases, the farmers will leave some of them in, or sometimes the farmer will say, I can't get all of them back into the house for you to vaccinate. Just vaccinate the ones I have. What was found was, the farmers found was that even when they didn't vaccinate all their herd, when an infection came and the neighboring farm had the disease, their cows didn't have the disease, although they only vaccinated maybe 85% of their herd. So farmers, because they wanted to save money, started deliberately not vaccinating all their cattle. What then happened was that veterinarians calculated the immunity for each vaccine so that when they go to a farm, they'll tell the farmer, you just have to pay me for, if they have 100 cows, you just have to pay me for 85 cows. The others will be protected. So that is where herd immunity comes from. Our target in humans is to vaccinate everybody. But sometimes we miss some people. But we're not too worried about it because if the people we miss are just scattered in the population, we won't have an outbreak. If the people we miss are all gathered together in the same place, and we've seen outbreaks of measles, this has happened, in which some religious groups do not take vaccination and we have outbreaks. There was an outbreak of measles like that in the Somali population in Minnesota and in the Hasidic Jewish population in New York. Because they were clustered together and they were not all vaccinated. So when the virus occurs, there can be an outbreak. But if they were scattered in the population, there will not be an outbreak. So herd immunity has never been used to stop a natural disease. So when you hear people saying that herd immunity is how we're going to stop COVID-19, it's probably not a good strategy to use. We know that herd immunity probably protected humans in the past when we didn't know anything about disease and people did nothing at all or just ran away. What you found is that on average, after 2 years, most epidemics historically, when people have looked at oral history, written history, disappeared. And what was thought that happened was that everybody left was immune so that the disease had nowhere to go and went away. Having said that, it is not a strategy you can use in an active disease because we really do not even know how many people need to, and we cannot use it as a strategy because, again, you still have mortality that is related to it. We've used it as a strategy for vaccination and is used commonly. So basically, saying herd immunity will save us is going to be a strategy that is bound to result in more mortality than places that use real serious public health strategies. Herd immunity and vaccination. Herd immunity, like I said, has always worked with vaccination. And vaccination is specific, right, for a disease. There is no coronavirus that has a vaccine. The reason is that common cold was too mild to create a vaccine for. 2, SARS disappeared. There was a lot of research going on to develop a vaccine for SARS, and it went away and people stopped spending money on developing it. And Middle Eastern respiratory virus, the one I told you about, respiratory syndrome, that one, what was used was testing the camels rather than even doing anything with humans. So basically, for any vaccine, we have to start from scratch. Viruses of the same family work alike. If we had a vaccine for a coronavirus, it will be easy to start a vaccine for COVID-19. The other part of it is that we do not know how long the immunity for COVID-19 lasts, the antibodies. So far, a lot of tests have shown that the antibodies disappear after about 3 to 4 months, maybe at most 6 months. Most of the vaccines we have are usually for lifelong immunity. Then people will talk about the flu. The flu, at least it lasts a year. It lasts the whole flu season. If it's 3 months and it's not seasonal, and COVID-19 does not seem to be seasonal, that will be a challenge. The other part of it is that COVID-19, like I mentioned to you, attacks the immune system, right? The immune system is part of what goes awry. For most diseases that attack the immune system, it's very difficult to create a vaccine for it. Hence, HIV has never been we've never been able to do something, create a vaccine. I'm going to kind of just talk to this. This map just shows the areas in the US that have the highest cases of COVID-19. And it relates to the highest populated areas. And just what I want to show you is that COVID-19 is a disease of people. It started in New York and California because they were the coastal towns that have a lot of interaction with the rest of the world. The one in New York came from Europe. The one on the West Coast came from Asia. But if you look at where the biggest outbreaks are today, it's where you have the most populated states. The disease is just doing what disease does, and it's looking for warm bodies to infect, looking for human bodies. So what are the public health tools that we need to use, rather than depending on herd immunity and vaccines that might never come? These are true and proven methods that humanity has been using. Contact tracing. If we have somebody that has the disease that we know, we trace all their contact and tell those contacts to quarantine. Quarantine just means that you stay put until during the incubation period of the disease, which was first thought to be 14 days and is now down to 10 days. You have no contacts with others so that you don't spread it. If we know you have the disease, isolate until you get better and you're not shedding the virus. The other part I didn't put here because it seems obvious is testing. Because testing gives us an edge, right? We're not going to wait until that person is showing symptoms. We're going to test them, and we're going to start this process earlier, and so we get ahead of the infection. These are known tools that we have used for generations and generations to stop disease outbreak and to stop any disease from spreading, and we need to go back to them. And so, again, I just want to say, this COVID-19 outbreak is a failure of public health. And if we go back to the true and tried public health tools that we have used as humanity to stop diseases from infecting us, we will be able to fight and conquer this disease. Thank you for listening.